Hello and Assalamu alaikum. Ultra scan diagnostics. This is the CBCT of the patient that you had requested. The area of interest highlighted is the lower anterior region. The kind doctor wants us to assess for implant placement underneath this old 6 unit bridge. On the panoramic view, we see that we have bone in the edentulous ridge under the anterior incisors. We will place implants for the kind doctor to evaluate how we've placed them. So this is the region of 3, 2. The ridge is quite comfortably thick here. If we go right below the crest of the ridge, we've got 4 millimeters of ridge width with approximately a good 10 millimeters of ridge height. Moving to the area of 4-2, the ridge is significantly thin in this region. However, we will measure just under, we've got a 3.2 millimeters of ridge width with approximately 10.7 millimeters of ridge height. Now, the bone quality in this region is D2. We've got good cortical plates and a healthy cancellous bone. We will place implants. The doctor has asked us to place iRes implants, so we will place the iRes implant that needs to be placed in the 4-2 region is a 3.4 or a 3.2 and 10 millimeters in diameter, and the implant that needs to be placed in the region of 3.2 is going to be a 3.7 or 3.8 10 millimeter implant. So we've got 10 millimeters of ridge height and we've got 10 millimeters of ridge height in this region for both the implants, and we have approximately 10 millimeters in both the regions. Now this is the implant placement. As you can clearly see that the implant has been placed here. We can show you the implants from an axial point of view. This is the tooth from an axial point of view. If we go close to the bone, both the implants, this is the right side of the patient where my mouse is. This is the right 4-2 implant, and this is the 3-2 implant that is placed. A 4-unit bridge can be attached over these implants and can sustain all good forces. So we will attach a uh, report, an implant planning report in this region as well, so that our kind doctor can evaluate. Moving to the lower right 6, the lower right 6 is grossly carious. We can see that this is the mesial side. We have a mesio-buccal and a mesio-lingual, but the caries is not infiltrating underneath the bone levels. The furcation area does not seem to be involved, and we can see that this tooth is definitely restorable using endodontics. We've got 2 canals in the mesial and we've got 1 single canal in the distal root. This is the distal, 1 single wide canal. The working length of the distal root is going to be approximately 20.6 millimeters, and the working length of the mesial root is going to be approximately 19.6 to 20 millimeters. So we've got total of 3 canals, as you can see in the axial view. This is the tooth. We've got 2 mesial canals and 1 wide distal canal. We don't see any major periapical radiolucencies. This is the grossly carious aspect. It's more so towards the buccal aspect, but it is definitely restorable. And this tooth can be restored using endodontics, a post and core, and followed by a crown in this region. So if you have any further questions regarding this case, please feel free to reach to our team and we would be extremely happy to help. Thank you very much.